Okay. If you notice that your cat is starting to look a little bit dry, it's a good idea to spray the cat down with preservative. We are using what's called Ward Safe, which is a well, we are using what's called Ward Safe, which is a water-based preservative. And you'll notice that I'm just gently spraying it all over the cat. This is going to help keep the tissues from drying out and becoming brittle. So we want to just, liberal spray. Make sure that you do this at least every hour, if not more frequently, depending upon how dry it is in the room. As you can see, we have both of our vascular bundles on the left side of the cat and the right side of the cat exposed. These are going to be our guides for opening the thoracic cavity. What I like to do is actually use my blunt probe as a shield. Just deep to the ribs, we would find the heart, the lungs, and a large grouping of arteries and veins. So using your blunt probe, gently start to probe the area where you see the blood vessels passing through the chest wall. I'm not going very aggressively here. I want to just do it nice and gently. And you want to try to keep the tip of the probe up. If you go in with the tip down, there's a chance you could catch those blood vessels. So I'm just going in with the tip up and just slowly working my way through. What we want to do, or what we want to see is that probe coming through the other side of the chest wall. Once that probe is through the chest wall, we know that those blood vessels just deep to that probe are going to be protected, and we can use the probe as a guide to open up our chest wall. And there we go. So the probe is through the chest wall. I'm just wiggling it a little bit more. I'd like a little bit more of the handle in there. And there we have it. Now that's going to be our guide. Now we need to remove the remaining muscles from the chest wall so that we can get as close to the ribs as possible. And I'm just going to use my 10-blade scalpel. We want to try to follow the line of the rib cage. We don't want to get into the abdomen just yet. We've got a lot of organs in there that could potentially dry out. So we're going to get into the abdomen last. So for right now, I'm just going to follow the line of the rib cage and just cut the muscles down, and then use the scalpel to gently shave that muscle off. So I'm keeping the edge of the scalpel elevated, keeping it pointed up towards the muscle. That way I don't accidentally dig down into the rib cage. So pop that little bit out right there. So I'm just taking and I'm just using the scalpel. And you can see I really don't even need to use the scalpel. That fascia is very soft underneath, and it will come out pretty much with just a little bit of force applied. But if you run into some difficult areas, you just gently run that scalpel right along that fascia, and you can see it comes off with no problem. So now we have this nice big piece of muscle here. We can go ahead and trim that off. We are going to do the same thing on the other side. Just follow the line of the rib cage, trying to stay away from the abdominal cavity. Get our scalpel underneath. Try to get a little bit of an edge that I can lift up on. There we go. So we're just going to then use the scalpel to shave that muscle right off. This is an important step. The bone nippers are really good at cutting through bone, but not really good at cutting through soft tissue. So the more of the rib cage you can expose, the better. Also, to help out, we can make a couple of reference lines. So I'm just using the scalpel to follow down to our cut, about a 1/4 inch on either side, the costal cartilage. So what I've just done is made a reference cut over the costal cartilage all the way down to where we had removed the rest of the pectoralis muscles. Sometimes it is a little bit easier to get through the ribs if you were to come down and also cut off this tissue right here. So we're just trying to get as close to the rib cage as possible. Sometimes the bone nippers will get through this little additional soft tissue with no problem. Sometimes they will tend to get hung up. So I'm just showing you this. You can try using the bone nippers as is without removing the muscles on the lateral side of the thoracic cavity. But if you're finding yourself having a difficult time getting through the ribs, then you definitely want to take that little bit of extra muscle tissue off. Okay. So now we're going to open the thoracic cavity. We're going to use our large scissors, and as you can see, one end of the scissor is pointed, the other end is curved. We are going to use the pointed end of the scissor to poke our way through the rib cage. You do not want to force the scissors through the rib cage because our lungs are just deep to it. So what you want to do is just insert the tip enough to catch the costal cartilage. And you'll know when you've got it because you'll see the rest of the rib cage elevate. There we go. See, I'm underneath one of the costal cartilages right now. And what you want to do with the tips of your scissors pointing up as much as possible, you want to cut through that costal cartilage. Now, it can be a little bit tough using the scissors,